Hi everyone, welcome back to another episode of Midnight Mental Talk. I am Adrian and my co-talker Leanne. Last week, as you guys saw, we talked about baby blues, and this week we're actually going to be talking about winter blues, which is also called seasonal affective disorder. A definition of seasonal affective disorder is depression that is associated with late autumn and winter, and it is thought to be caused by the lack of sunlight. So if you or anybody in across Canada right now, you could experience that because most of us have snow or some variation of it. SAD, which is the abbreviation version, is thought to be caused by a decrease in the exposure of natural sunlight, which leads to decreased levels in serotonin in the brain. This normally happens during, like I said, the fall and winter seasons when our sunlight is very limited. It's a relatively new disorder, and it's not really studied a whole lot, but it's starting to become studied a lot more.
Well, I can tell you that they say about 2 to 6% of Canadians experience this within their lifetime, and about 15% experience a milder form of it. The risk factors or triggers for this seasonal disorder, you could inherit the vulnerability, or you mentioned light deprivation and stress and biological factors in a unique individual and early childhood trauma. One of the key things to preventing seasonal affective disorder is taking a vitamin D supplement throughout the winter. And as for serotonin levels, just have more sex.
Well, that's awesome.
So that's my advice for fixing seasonal affective disorder. Why don't you tell us some symptoms?
Actually, before I go along with the symptoms, how you mentioned you can find like vitamin D supplements in grocery stores or pharmacies or whatever.
Yep.
If you are actually very low on the vitamin D level, you can also get shots. So your doctor may prescribe you getting like shots that are monthly or something. Symptoms include tiredness, fatigue, and poor sleep. It's sort of balled up together. And then you have crying spells and depression. Yeah, trouble concentrating, which, body aches, loss of sex drive, and a decreased activity level, overeating. And one thing they say to avoid, that if you have seasonal affective disorder, is avoid eating carbohydrates. And also you can, like, if you are a big sugar person, if you eat a lot of sugar, that turns to carbohydrates, which also turns into fat. And fat also can present itself in the summer, which is called summer depression. And the symptoms for that would be insomnia, poor appetite, weight loss, and it also includes irritability, difficult concentrating, and crying spells. Causes your biological clock.
You can start that over.
Reduced levels of sunlight in fall, winter may cause winter onset SAD. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. Just wanted to quickly say that somebody who works night shift should also be careful of like SAD, because you're less likely to see the sun as somebody who does day shifts. So if you are somebody that feels like you are starting to feel depressed or whatever, you may have to get vitamin D supplements or the D light, which I will explain after. Okay. Another cause is the serotonin levels. A drop in your serotonin levels, which is a brain chemical, can affect your mood. This might also play a role, and reduced sunlight causes a drop in serotonin levels. Melatonin levels. The change in season can disrupt the balance of a body's level of melatonin, which plays a role in sleep patterns and mood. Some risk factors I'll quickly say is apparently one of the risk factors is being female.
What?
Yeah, apparently we're more susceptible to getting SAD than men. Your age, young people have a higher risk of winter SAD, and winter SAD is less likely to occur in older adults. Probably because by then they're used to it. You have a family history, which you mentioned.
Yeah.
Having clinical depression or bipolar disorder. The symptoms of depression may worsen seasonally if you have one of these conditions. And I have to admit that there are some people I do know that are bipolar that I do notice that their depressed mood incredibly increases when the sun is like not around as often. So maybe that's another thing you can talk to your therapist about. Maybe see about getting a D light or vitamin D supplements. And not saying that it's going to help entirely. It's not going to be the cure-all, but it could very well help a little bit more than, not acting at all.
That's the second time you mentioned a D light. Could you tell us what it is?
The D light is essentially, it's just like the sun. It mimics the sun. It gives off vitamin D rays. So it's kind of like the tanning bed. It's the same type of UV rays, but it's not going to like give you a tan or anything. It's going to like help boost your mood, and you're only supposed to do it. You should only do it for so long a day. Mm-hmm. You should be about 2 feet or closer, but not like right on top of it. Honestly, some people do go to the tanning bed not just because they like having a tan, but they also go to the tanning bed because of the benefits of feeling happier after they leave. Because when I went to Cuba and I went to the tanning bed 1 to 2 times a week, before I left, I totally felt 100% better. Like, I actually felt good. The other risk factor is living far away from the equator. So the closer you live to the equator, the less likely you're going to be affected by that.
Since we're talking about the light therapy and whatnot, there can be some side effects of that. And can I just mention them?
Oh yeah, go ahead.
The light therapy seems to have very few side effects, but side effects can include eye strain, headache, fatigue, irritability, trouble sleeping at night if light therapy is used too late in the day. This website that I'm on for seasonal depression, it's ementalhealth.ca, right there at the bottom. They say caution is required with light therapy in people with bipolar or manic depressive disorders due to possible risk of causing a manic episode. Also, people with skin that is sensitive to light or medical conditions that make their eyes vulnerable to light damage. Tanning beds are not helpful for treating seasonal depression as they provide a different type of light. They do the UV light that is more for tanning than for helping depression. Sorry to contradict what you mentioned in the tanning bed.
I just know from my personal experience, I felt better going to the tanning bed. But so I guess the key is always talk to your doctor before going and investing in one of these lights or any other kind of light therapy, and make sure that you're not susceptible to any of those kind of side effects. And I do know that it is best to use the D light first thing in the morning. As soon as you get up, use it for the 5 to 10 minutes or however long the doctor tells you to use it. It's not something that you really sit in front of probably for an hour.
But how do you define what's enough? Do you go and get blood work done to see what your vitamin D level is sitting at prior to getting a D light? Or do you just guess and improvise and try not to expose yourself to any of these side effects because you screwed it up?
Yeah, I would think you might have to go get blood work done, I would think.
Okay.
I found 7 ways to combat that, and one was schedule social activity throughout the season, or to take vacation to a sunny locale. Use a dawn simulator, a device that gradually increases the light in the bedroom in the early morning hours to help you wake up more efficiently or more naturally. Avoid the temptation of carbohydrate-laden comfort foods. The quick spike and drop in glucose can affect mood and energy levels. Get outside and walk during the day as much as you can. Connect your lamp to a timer that turns the light on in the early morning before the sun comes out. Avoid tanning beds. Okay, apparently I lied about the tanning bed thing, guys. Apparently I'm just full of it.
If we hadn't corrected ourselves about going to the tanning bed and then they go and end up getting skin cancer because some blowjo listened to us and was like, I'm going to the tanning bed so that I don't get winter depression, and they end up with skin cancer, and then they come back and sue us because they listened to our video, which, by the way, folks, we are not professional doctors, therapists. Adrian has...
I went to university for my psych degree, and eventually I hope to finish it. As I say finish it, maybe get higher up, another level.
See, there you go. So she's got the credibility. I just ask the questions and make the videos. Why don't you go ahead and subscribe to our videos so you can find out what next week's topic is going to be and suggest it to us, actually, because we don't have anything in mind. So we're going to wrap for this week, and it was good to talk to you again, Adrian.
Yes, absolutely. You guys have a great week. Alright, so are you recording now or am I just fucking around?
Excellent.
What you doing?
Nothing?
Oh my god. Holy god. Please tell me you're doing most of the talking. And am I asleep right now?
There.
The risk factor. Fuck.
Wee, all the way home. Hi! And you. We want. Okay.
Adrian. Now my kid's called Adrian.
Is your bio.
Repeat yourself. I didn't hear any of it. Got the winter blues. Take vitamin D and you'll smile again.